Welcome to the Holistic Research Academy. I'm Dr. Jean-Paul Lamonte, and in this video, we're going to be going through natural neck pain relief. Check it out. And stay tuned because at the end, I'm going to show you my favorite, most effective neck stretching routine to help open up those muscles and give you some pain relief. So when we look at the neck and the structures of the neck, it really has to do with the cervical vertebrae and the muscles that are around them. Now, you can certainly have neck pain that's coming from other areas of the body, like your mid-back or your shoulders, but in your neck, you have 7 cervical vertebrae. Count them up, 1 through 7, and this supports the head. And at the very top of the neck, C1, 2, and 3 is where we get most of our rotation. So if you ever have any discomfort turning from side to side, it's probably in your upper cervical. Now below, C3 down through C7, is where we get more of our side-to-side movements we call lateral flexion. So if you tend to have more discomfort or pain going side to side, it tends to be more of these lower cervical vertebrae. Now, as for your muscles, you have a balance of muscles from the front, back, and sides of your neck that help maintain that position. So notice if you have a forward head or forward shoulder position. So this is usually called upper cross syndrome. And in upper cross syndrome, it's where we're rounded forward and we start to get tightness at the base of our skull from your suboccipital muscles that can even recreate many different types of headaches. We also get tight down in the front of our chest and our pec minor specifically, but we also feel this tension in the front of our neck from the overstretching of the SCM muscle and also between our shoulder blades from the overstretching of the rhomboids and across the middle trapezius. Now, before we begin, avoid anything that creates significant or sharp pain in your neck, and certainly consult a physician to rule out any fractures, dislocations, or severe injuries. So for a simple assessment of the range of motion in the body, you can follow along with me here now. So first begin by sitting up nice and tall, and as you inhale, always get nice length through your spine, sitting in upright position. Now first you're going to begin just by exhaling and bringing your chin down towards your chest, and you can even give a little bit extra stretch at the end. As you inhale, come back to center. And now as you exhale, just reach your chin up, kind of stretching the muscles in the front as opposed to pinching or compressing in the back. And just do that a few times. So as you inhale, come back to center. As you exhale, slowly bring your chin down. Inhale back to center. And as you exhale, slowly reach your chin up. And after a few times, you'll start to warm up and stretch the muscles and tissues around your neck. And you might even feel the joints start to relax and loosen up a bit. Now the next motion is going to be going side to side, or we call lateral flexion. Now when we do side to side motions, we're stretching and activating all the muscles in the neck. So it's a really good way to stretch the neck and assess what's going on. And as we said, most of this is coming from the lower part of your neck. And so as you inhale, sit up nice and tall. As you exhale, just simply bring your ear towards your shoulder. So you can start with the right or the left side. As you breathe in, come back to center. As you exhale, simply go to the other side. Now you want to make sure your shoulder doesn't come up with it, so just relax your shoulder down away from your ear. And at the end of your exhalation, just hang there a minute and find after a few seconds, see if you can just relax a little bit further. And after doing that a few times, you'll get a good idea of where any tightness, any muscle knots, or anything locked up in your neck might be. Now the last motion is rotation. As we said, most of your rotation comes from your upper cervical part of the neck. So as you inhale, sit nice and tall, and as you exhale, slowly turn and look over each shoulder. And again, just hang there for a few seconds at the end of your exhalation and try to just gently go a little bit further. Inhale brings you back to center. As you exhale, slowly turn, look over the other shoulder. Good. Now do that a few times, about 3 to 5 times, and just feel the warm-up effect. Meaning areas that might feel tight or have discomfort after a few rounds, they start to loosen up and begin to go away, especially if it's due to tightness in the muscles or your joints. So as you're doing these simple range of motion stretches, you can also couple the motions together. So coupled motion is basically how we move throughout life because we don't just do one direction or the other, but we do them together. So for example, you can bring your chin all the way down and then begin to add a little bit of side-to-side motion along with a little bit of rotation, right? And then kind of fine-tune and check in to identify any areas that you feel tightness. So if you do feel tightness in your neck, here's a few natural things that you can do. First of all, If it's red and swollen from a recent or an acute injury, then you want to put ice on most conditions. Icing for 10 minutes at a time is very effective for reducing recent or acute inflammation, especially if it's swollen, red, and really tender to the touch. So for the most part, most chronic neck pain or tightness, you want to use heat. Now you can do this by getting a nice hot shower and pouring the water right at the area for about 5 to 10 up to 15 minutes. But one of my favorites is using Epsom salts. Epsom salts naturally has magnesium sulfate. And if you add Epsom salts to hot water and create a saturated solution, which means however amount of water you're using, you want to add Epsom salts until there's still salt floating around. The water is completely saturated. You can dip a towel and place it over the area of your neck, again for about 10 to 15 minutes, and you want to keep it warm to hot. Now please do not burn yourself, but by keeping a warm to hot Epsom salt compress, this will naturally relax the muscles and help to relax the tissues around them. So let me show you a simple way that you can work the tissues around your neck, and it's simply myofascial release. So if you bring your fingertips together and find any tight areas, as you begin to move your head and your neck, you can gently pin or press into those areas as you stretch along with the tissue. Now don't overdo it, but focus on the tight areas and give it about 3 to 5 good passes. Now, another thing is simply lifting the muscle in the skin and just rolling back and forth. So I like to do skin rolling, myofascial release, going back to front, but also front to back. You can really release some of the tight areas around your neck, and it's really effective after you've applied heat or warmed up with exercise or stretching. And lastly, if you can identify the specific muscle knots or trigger points in your neck, bring your fingers right into them. Now, what I like to do is kind of gently bend and lean towards it. So when you relax a muscle, it helps to decrease the pain and pressure. It makes it a little more comfortable. And I'll hold and I'll just simply vibrate right on the tender spot and then relax. Breathe in and out a few times. And after about 10 to 30 seconds, you can actually feel the fibers inside the muscles begin to relax and unwind. So do this a few times and see if you can release the muscles around your neck. Now, once you're warmed up, you start to move a little bit, worked out some of the muscle spots, let me show you my favorite stretching routine. It uses a type of PNF stretching, and PNF stands for proprioceptive neuromuscular facilitation. By changing the position sense and the nerves in the muscles, we can increase range of motion and decrease pain. Now, this stretch specifically is referred to PIR, which stands for post-isometric relaxation. So every time you contract a muscle, right, by physical law, after you contract it, it has to do what? Relax. Very good. So if you contract a muscle at the very end range of its flexibility, by law afterwards, it has to relax and go a little bit further. So let's use this biophysical law to our advantage. Let me show you. First, I'm going to pick which side of my neck I'm going to do, and we're going to start off with just side-to-side stretches. So I'm literally going to sit on one hand to anchor the shoulder down. I'm going to take a deep breath in, and as I exhale, I'm going to gently bring my neck all the way to the end range as far as it can comfortably go. Now I'm going to breathe fully in, and I'm going to hold my breath at the top. I'm going to keep holding my breath while I contract this muscle group here. And since lateral flexion or side to side uses almost all the neck muscles, it's a really good universal stretch. So I'm going to hold for several seconds, and then as I exhale, I'm going to relax the neck and see it goes a little bit further. Now don't force, and again, avoid anything that creates too sharp or significant pain. But right at the edge, I'm going to do that one more time. Take all the slack out and I breathe in. I hold the breath while I press into my hand and resist. And the neck gradually goes just a little bit further. So again, you don't want to force this. And each time you're going to move maybe a couple millimeters, maybe half of an inch. But over time, it definitely adds up. So let's do the other side. So you want to sit on your hand to anchor your shoulder down. Inhale, sit up nice and tall. Exhale, slowly bring your ear to your shoulder and take all the slack out of the neck right to the end range. Then take a full breath in. Hold your breath as you press into your hand. You only need like 10%, so you don't need to press too hard, but just enough to activate the muscles. And then as you exhale, relax. And your neck goes a little bit further. One more time. Full breath in. Keep holding your breath while you press your head gently into your hand steadily. And just do this for a few seconds, about 5 to 10 seconds. And then when you're ready, exhale, relax the muscles, and gently guide just a little bit further. And I know every now and then I'll get some good pops or releases in my neck. And as long as those pops or joint cavitations feel good, you're definitely helping your body. Now, the next step is to then modify that side to side stretch. So when you're doing a range of motion assessment or you feel where the tight areas are in your neck, here's how you can specifically customize this stretch for your neck and your body. So again, I'm going to sit on the hands to anchor down. Now we're going to do coupled motion, PIR therapeutic stretching. So first, I'm going to take all the slack out right to the edge. And then what I'm going to do is I'm going to add a little bit of rotation and flexion, right? And I could do the same stretch here by pressing on the back of the head. Again, exhale, take all the slack out, then inhale, press. Hold the breath as you keep pressing into your hand. Then as you exhale, relax the muscle and go a little bit further. Now you can also do this gently in extension, but again, listen to your body and please be careful. So you can also look up to the sky to stretch the front of your neck or your SEM or anterior neck muscles. And again, just take all the slack out, breathe in, hold the breath, press into the head. So you want to feel the muscles contract, but contract at their end range. And then as you exhale, just softly guide just a little bit further. And after repeating this a few times, you'll start to feel an increase in range of motion. Your tissues and muscles should feel looser and your joints a little bit more relaxed. So let's do the other side. So I'm going to sit on the hand to anchor it down. Now on my right side, when I first go to the side, I can feel specifically that it's this line of muscles. So I'm going to start by rolling my chin down, adding rotation and a little bit of flexion. And now, right to the end range, take all the slack out, breathe in, hold the breath, gently but steadily press the head into the hand, resist to activate those muscles. I want to contract them for 3, 2, 1, then exhale, softly relax, and one more time. Full breath in, hold the breath, press into the hand, exhale, relax, and a little bit further. Definitely gives some relief, stretches things out, and helps to decrease pain. So by combining and integrating these different things of stretches, range of motion, hot or colds, also of course adding adjustments. So as a chiropractor, I help people with neck pain every single day. You can check out my website at hhcare.org if you ever want to book an appointment or schedule a consult. But by combining adjustments, massage, stretches, cold packs, hot packs, and specifically finding what works best for your body. And remember, the holistic view is always it's the body, mind, and spirit. So notice if you're holding any stress or any tension in your neck or shoulders, or if anything or anyone is literally being a pain in your neck. You need to identify all these factors. And if you can treat the whole body and the whole person, that's the holistic way. So try these things out and let me know in the comments below what are some of your favorite natural neck pain relief techniques. So thank you so much for joining me in this video. Please check out my other videos on my YouTube channel. Like, subscribe, all that good stuff. And certainly, you can head to the website or check out the link below for natural healthcare products. See you in the next one.